Hi, everyone. Thanks so much for your patience. Welcome to Experience VCC. This is the healthcare session. My name is Elizabeth. I'll be your moderator for today, and we're excited to have you here. So thanks so much for coming today. Now, the way this is going to work out is we're going to hear a presentation of a couple of our instructors. They'll be speaking to you for about 2 to 3 minutes, and then we'll have an advisor speak to you. And then we're going to go through questions and answers. So if you do have a questions, please type that in the chat. We will get to that towards the end of the session. And yeah, let's try to make this interactive as much as we can. So I will be reading your questions out loud, whether you send that to us privately or to the whole group so that it can benefit everyone. All right. So before we begin, I'd like to acknowledge that we are still working on the unceded territory of the Coast Salish peoples, the traditional home of the Squamish, Musqueam, and Tsleil-Waututh nations. So I'd like to remind you that there is still a contest going on if you would like to get a chance to win $1,000 in tuition. There will be a code at the end of the presentation, and so stick around so you can get that code and you'll be able to enter into the contest.
Join through your Zoom.
Again, a couple of housekeeping items to make sure you're on mute, and we'll open it up to questions later if you'd like to ask us a question. Okay. Q&A, as you all know, should look something like this. And without further ado, we'll try to dive into our programs here. So the first program you're going to hear about is acute care for healthcare assistants and the healthcare assistant program. For that, we have Aki here with us to talk to you about these. So Aki, the floor is yours. Take it away.
All right, thank you. So again, my name is Aki. I am one of the instructors from the healthcare assistant program. Some of you might be wondering what an HCA is. So an HCA is a trained healthcare worker providing care and assistance to the elderly, people with physical challenges, and also with developmental challenges. One of our biggest role as an HCA is to assist our clients with their activities of daily living. So that would mean helping them with their nutrition or their meals, ambulation or walking or using a wheelchair, bathing, showering, dressing and grooming, and also participating in different recreational activities with your clients or your residents. So there are several areas in the healthcare system that we could work in. So complex care is one of them, group homes, assisted living. So you're going to learn all of that when you join our program. And so if you wish to join our program, our admission requirement is grade 10 English for applicants whose first language is English, and for applicants whose first language is not English, you will need to present your CLB-TP scores, which I'm sure your advisors will be happy to discuss what requirements those are. I hope I'm correct on that. And some other requirements such as standard first aid, CPR, food safe, criminal record check, proof of negative TB skin test, and completed immunization history. So those are our admission requirements for this program. So currently we have 3 programs in the continuing care department or the HCA department. So the first one is the full-time program, which is 7 months long. There's usually about 36 students in a class, and most of the time there will be about 3 to 4 instructors in there. This is a Monday to Friday program. Right now, everything is online except for the lab days or laboratory days. One of the good thing about this program is that there's 3 intakes. So September, January, and May are the intakes for the full-time HCA program, and the tuition is $3,500. The other program that we have is the HCA ESL. So if there are applicants whose CLB PT scores doesn't match for the full-time program, this is a very good program for you as well. So it's relatively 10 months, a little longer than the full-time program because we incorporate the English classes in here. So from the beginning towards until the end of your program, you will have those classes as well. So it's also Monday to Fridays class. This is relatively a small class of 12 students. So that's what I like about our HCA ESL as well. So it's a smaller class, and there's usually about 2 classes running of 12 students each. Tuition is at $6,000 right now. And we only have 1 intake in a year, and that's in September. We do have a new program that we just started this fall, and this is a part-time option. And so the classes for this would be Tuesdays and Wednesday evenings and all days of and Saturday. So this is where I am teaching currently. Usually we have only about 12 students as well. The program will be about 12 months. And tuition is $3,500 for that. Yeah, and also, yeah, why do we want to become an HCA? So 1, competitive wages and benefits. Usually, if you work in the healthcare system as an HCA, most of the areas are unionized. I believe right now in the union, it's about $22 per hour for HCA. There's flexible employment options. You can work casual, full-time, part-time, whatever suits your need. Job security. I was told that for our HCA grads, we have about 94 to 99% success rates in employment. And this could also be a good way for you for career advancement. So if you wish to work in the hospital later on, you can upgrade your certification to acute care healthcare assistant, and as well as if you meet some criteria to ladder it up to become to be in the PN program or in the BSN program later on, then we do have that in VCC as well. Yeah, and lastly, of course, being an HCA is a very rewarding career, right? So finding meaning in what we do, making an impact to the lives of other people is something that I think is a good thing to have, and being an HCA is one of that. So yes, apply now. We don't have a wait list at the moment. Thank you.
Thank you so much, Aki, for that rundown. Very thorough. For those of you who have just joined us on this call, this meeting is being recorded. So if you did miss a couple of things at the beginning, you feel free to, we'll send out the recording later on. So we just spoke about acute care for healthcare assistants. Now we're going to move on to another program, which is medical device reprocessing technician. We have Rebecca, who's here to talk to you about this program today. Rebecca, the floor is yours. Might need to unmute if you're on mute, please.
Thanks, Elizabeth. Sorry about that. So my name is Rebecca, and I am the program coordinator for the Medical Device Reprocessing Technician Certificate Program. That's a bit of a mouthful, so we refer to it as the MDRT program. It's a lot easier. The first question I usually get from students is, what do MDR technicians do? Most people have not heard of it, even though the MDR department is the heart of the hospital. So MDR technicians usually work in MDR departments within a hospital, big hospitals, small ones. They also work in private surgical clinics. All dental clinics have MDR areas. Veterinarian clinics have MDR areas. LASIK MD, eye surgery centers have areas where they reprocess the instruments. So the MDR technicians work in the department. They reprocess reusable surgical instruments. So if anybody here has ever had a surgery before or has gone in for some kind of testing in the hospital that requires specialized equipment, chances are, high chances that that equipment, the surgical instruments, have been used on previous patients. So the MDR technician's job is to make sure that those instruments and equipment is reprocessed, cleaned, sorted, wrapped, sterilized, and ready for the next surgery. So patient safety is the #1 priority for everybody working in the MDR department. The people working in the department, it's a close team. They work closely with the surgeons, the operating room nurses, other departments in the hospital to make sure that everybody that goes into the hospital is safe from infection. So they work a lot around infection control and prevention. The MDR department, like I mentioned, is the heart of the hospital. So surgeries cannot happen without the instruments being reprocessed, cleaned, sterilized, and make sure they work. So even a lot of people that work in hospitals, they don't even know that there is the MDR department, or they're not very familiar with it. They just, the surgeons just open up their instrument kit when the patient is lying on the table, and they just assume that it's showing up clean and ready to be used. So the VCC MDRT program is unique. We've been working with the local health authorities for the last 32 years approximately, since 1987. So I hope my math is right. And we're the only college in the Lower Mainland that offers the MDRT program. The closest MDRT program to here at VCC is on Vancouver Island University and Prince George and the Okanagan. So all of the hospitals in the Lower Mainland, they get their students, they get their employees right from VCC. So that's one of the best things that I would say about this program, is that when we run the MDRT program twice a year, the managers in the hospitals are waiting for the program to end to hire all of their employees. The managers have told me that approximately 99% of all MDR technicians in all of the hospitals in the Lower Mainland graduated from the VCC program. So that's pretty great. So the students don't have to look for work when they're finished usually. They usually get hired. The managers are waiting to interview the students at the end of the program, and they get hired within 1 to 2 months. The program is 4 months long, full-time, Monday to Friday. It takes place in local hospitals. We have theory that is blended online and face-to-face right now because of COVID. Usually it's face-to-face. Most of it is online. And the clinical sites are in BC Women and Children's, VGH, St. Paul's, Surrey Memorial, Royal Columbian, Abbotsford Regional Hospital. So we have quite a few sites that we work with the managers to place students in. As you all know about COVID, it's affected a lot of the operations that were scheduled over the last 6 months. They were put on hold because of COVID. The Ministry of Health has released a BC surgical renewal plan. And in that plan, they specifically mentioned the increased need of MDR technicians to help reprocess all of the surgical instruments that are going to be used on all of the operations to make up for all the canceled ones, and also the ones that would have been scheduled. So there's a huge need for MDR technicians right now, more than I've ever seen in the 12 years that I've been working in this program area. All of the hospitals are hiring. We have increased the numbers of students that we're putting through the program. So I would say that the labor demand is huge right now. When MDRT graduates finish, it takes about 1 to 2 months to get hired. They start off as casuals because they're in the union, HEU, Hospital Employees Union, all of them. They start off at casuals, takes about 6 months to a year to get hired permanent. They get about $24 an hour plus 12% in lieu of benefits as casual. So their hourly rate is approximately $27 an hour. And then if the technicians are willing to work evenings and weekends, that will bump their hourly wage up to about $29 an hour, $28, $29 an hour. In regards to the tuition, it's about $9,800 right now. And this program is eligible for student loans. A lot of students also have success in getting funding through Work BC. And I'm just finishing up here, but I just want to mention some of the characteristics that MDR technicians need to have, and especially when they go into this program. They have to have a high level of responsibility and accountability because it's all about patient safety. We all know that patients can get infections, and worst case scenario is that somebody dies within the hospital. So the MDR technicians have to be responsible and accountable for the work that they do. They have to have attention to detail because it's very fine work sometimes. They have to have really great communication skills. English, reading, writing, listening, and speaking is really important in this program and in the work that they do. If you have questions about the admission requirements, you can definitely send me an email to health@vcc.ca, and then I can go into more detail in the emails about admission requirements and what your background is and what you need to do to get into the program. Thank you.
Thanks so much, Rebecca. All right, I did see a question, but we'll get to that in the Q&A period. For those who have just joined, this meeting is being recorded, and you can also type in your questions in the chat box, and we'll get to that later. So we're going to move on to our other program that we offer here. It's the Medical Laboratory Assistant Program, and we have Heather who's here with us today to talk about that. Heather, it's yours.
Hi there. So the Medical Lab Assistant Program. What an interesting and exciting time to start a career in healthcare, right in the middle of a pandemic. Excellent, good times, great choice. We're going to need all the MLAs we can handle. So what are you going to learn here in the MLA program, Med Lab Assistant Program? Our primary function is collecting blood samples. So you might be wondering, how do I learn to do that in these strange times? So the program is 5 months on site here at, well, not all on site, 5 months with your instructors here. Part of that is self-directed online. Another part of it is through Zoom sessions like this. And the other part is we get you on campus a little bit, and we get you with needles and fake arms first. My props don't show up. It's a fake arm. So this is your first patient. And then when you're good at that, we move you on to collecting blood from your classmates, which I promised you is 100% fun times. Very scary times, but we get you there and everybody stays safe. The other thing you're going to be doing in this program is electrocardiograms. So ECGs, if you've ever saw that. In fact, in the photo there, you can see all those gals. They're standing so close together without their masks on, aren't they? Isn't that a strange photo to look at now? When you're on campus with us now, you'll be doing those same things, but with a mask and a face shield on. So again, with us here for 5 months, and then a 1 month practicum, 4-week practicum, where we place you somewhere in the Lower Mainland at either a hospital lab or a private lab. And then you get out in the workforce, and I promise you folks, you are needed out there. All of our graduates seem to get snapped up quite quickly. So not unlike what Rebecca was saying, within a month or two, most of the students have gigs. A lot of them are casual, but I'm actually seeing a lot of different things happening now with part-time and even full-time work very quickly out of school. So I think it's a good time to choose this, and hope to see some of you.
Perfect. Thank you so much, Heather. Sounds definitely like a fun program. I hope a lot of you here are interested in taking a lot of these programs. Okay, we're going to move on next to occupational health. We have Carmen here who will be speaking to you about this program. So Carmen, it's over to you.
Hi everybody. Thank you very much. My name is Carmen. I'm the program coordinator for the Occupational and Physical Therapist Assistant Program. It's a 2-year program that's full-time, much like the other health programs. Right now it's blended between on-campus learning and Zoom. Our program is accredited across Canada, so once you complete our program, you can work anywhere in Canada that you're interested in. It's very, as you can see through the photos, it's very practical, it's very hands-on, and we also complete 17 weeks of practical training in the hospitals. They're called practicums. So there's 3 different opportunities that students have to go to the hospitals and practice with patients, and they're partnered with a physiotherapist or an occupational therapist while they're on site. We have 1 intake a year in September, and it's we have 20 students per class, and it's a 2-year program, so we're running 2 cohorts at the same time while you're here on campus. Our program also transfers for 2 years worth of university credit if you're interested in continuing your education and possibly going on and completing a degree. So the role that the occupational therapy assistants and physical therapy assistants do is typically we work in, you're partnered with a physiotherapist or an occupational therapist, and you work in the hospitals. You might work in a rehab center like GF Strong. We work in residential care. We also work in the community and in a growing field in mental health, which is a great opportunity. So we partner with all different members of the healthcare team. We do things like we assist people who have had significant sort of illness or disability. Say if we're working with a client who has had a stroke, we might be teaching them to dress one-handed. If we're working with a client who has had a spinal cord injury, we might be teaching them to use their wheelchair outside to access transit or get into restaurants. Sometimes we work with clients who have sustained amputations, and so we teach them to put their prosthetics on and off and how to function that way. So we're constantly working hand in hand with our clients to sort of improve their independence. And right now, it's I'll mention too, the job market is very good for most health programs. So our students graduated in the beginning here of COVID in April, and they were all kind of snatched up and got hired right away. So typically, as in other programs, you start working casual and then move on to more of a full-time job. That's a little bit about the OT and PTA program.
Thank you so much, Carmen. It sounds like our graduates are always in demand here. Okay, so we're going to move on next to our next program that we're presenting today. It's our pharmacy technician program, and we have Wayne who's here to talk to us about this program. Wayne, go ahead.
Hi, I'm just sharing a laptop with Carmen, so I might appear as Carmen. I'm going to share with you information about the pharmacy technician program that is not already on our website. That's a good place to go to find a lot of the detail. I'm going to try to highlight the extra information that isn't readily available there. So one thing to know for the pharmacy profession, there's two main roles in the pharmacy profession, and you've probably all seen a pharmacist. A pharmacist is focusing on the patient. Their main task is to identify, prevent, and resolve drug-related problems and to help with making sure the patient has the right therapy that's most effective for the patient. In the background, which we don't see as easily, are the pharmacy technicians. They have an important role. They're primarily responsible for preparing the drugs, distributing the drugs, and managing the dispensaries. So they tend to be a little bit behind the scenes. Our program is designed to teach students and prepare them to be a licensed pharmacy technician. After graduating from our program, there's several steps involved to become a licensed pharmacy technician in Canada and in British Columbia. For example, there's a provincial multiple choice exam, a federal exam that's spread over 2 days. One day is a multiple choice exam, the other day is a practical exam. And then there's also a structured practical training that has to be completed. So the timing and the cost to become a licensed pharmacy technician is about $3,000 to $3,500. $3,000 to $3,500 is what I meant to say. You can see our tuition and our program structure on our website. So in terms of our program, there's a demand for pharmacy technicians. Most of our students get employment, often in hospitals, sometimes in retail pharmacies like Shoppers Drug Mart and Safeway, within a month or two of graduating. 99% of our students report that they were very satisfied or satisfied with their education, something that we're very proud of. And our program is fairly intensive. We have 14 courses total. 13 of them currently are being delivered in a blended model. So because of COVID, we're doing all of our classroom-based courses online instead, because we're using an online platform and Zoom. And then we are bringing students onto campus 3 days a week to do dispensing labs and compounding labs and sterile products labs. So that's where they practice filling prescriptions, making creams and ointments, and making intravenous medications. So that's likely to continue for the foreseeable future. But the good news is that although it's an intensive program, it's manageable, and the job outlook at the end is very good. So that helps a lot with the workload that has to be put in ahead of time. So more information on the website, and I think you'll also see a link to an info session that I have scheduled for October 28th. So if you want more specifics, you can always link to that.
Thank you so much, Wayne. And yes, indeed, the information's right here for the upcoming info session. Now, you've heard only about 2 to 3 minute speech of each of our programs today, but if you do want to dive in a little bit deeper and speak, let's say with someone for about an hour, get to know a little bit more about these programs in depth, these info sessions are a great place to start. You can sign up for free at vcc.ca/info, and we'll have other dates for the other programs there as well. Okay, so we're going to now hear from our advisor, Dom, who's here with us today. He's going to tell you a little bit about requirements and all that kind of stuff, and what you need to do next if you want to apply. So Dom, it's over to you.
Thank you, Elizabeth. Hi, my name is Domingo Salvio, and I'm one of the 6 academic advisors at VCC. So as our job is to look at your documents and how you're going to get into each of these programs as explained. As you know, to become a student at VCC, you need to be able to provide a copy of your transcripts. So that's a very important thing that we're going to look at. And these programs actually requires specific requirements such as proof of English language proficiency with appropriate final mark, and also different prerequisites like biology 12, chemistry 11, or math 11, or keyboarding test, and so on and so forth. So we're going to look at that when you meet with us. The best way to connect with academic advising is by phone. You can book an appointment by calling 604-871-7000, and I'm pretty sure Elizabeth will put it down later. Again, 604-871-7000, press 2. You can also book an appointment to speak with us via Zoom. And we have actually been offering drop-in sessions for about 15 minutes, which is every day. From 2 to 4 p.m. So that's from Mondays to Fridays. So when you come to speak to us, again, we're going to look at your requirements. And if you do need some assessments, we'll provide you with the information on how to make these assessments. And you come back again to us, and we'll tell you pretty much the result of your assessments. If you need some upgrading, we'll help you with that as well. So yeah, so this is fun times indeed, and looking forward to meeting you, and in either by phone or Zoom. There you go.
Thank you so much, Dom. Yes, our advisors are very friendly and are more than willing to help you and help you succeed. So by all means, feel free to reach out. And we also have drop-in advising today from 12 to 5 p.m. So I'll send a link towards the end in the chat for you to access that. Okay, so I've been seeing quite a few questions come in the chat box. We're going to move on to questions now. And if you have any, please keep it going. I'm going to start from where I see at the top here. For MDRT, are there any further career growth opportunities in the future?
Hi, Elizabeth. So I've jotted down all of the questions for MDRT.
Perfect.
So should I just answer them all at once and then leave it to other people?
Sure.
Okay, I'll do that. I can answer them fairly quickly. So one of the questions was future career growth. So when the students finish the program, they get hired as casual technicians, then they can move into permanent full-time positions. There are opportunities to become senior technicians within the hospital MDR departments. Some of the hospitals have MDR educator positions within the health authority. Some hospitals have MDR coordinator positions. All of the VCC instructors have also started as MDR students. So those are the career opportunities. Another question was about autoclaving. Yes, they learn all about autoclaving in the MDR program. Okay, the email for admission is health@vcc.ca. So if you have questions about the admission requirements, or if you'd like me to look at your educational documents, please send an email to health@vcc.ca. The waiting list is not long at this point. We offer the program at the beginning of January, the beginning of September, twice a year. And there's still space for the January intake, which starts on January 11th. And there's tons of space for the September 2021 intake. The students per intake, anywhere between 21 and 27 for the program. And then each clinical site takes between 4 and 9 students. How to apply for EI funding, contact your closest Work BC office. They will guide you through it. And in terms of what is offered in class, what is offered in person or online, the theory is a combination of online and in person, mostly online, and all of the practicum is face-to-face in the MDR department. And the next info session is to be determined. I will schedule that and then send everybody on the MDRT info session list an invitation.
Perfect. Thank you so much, Rebecca.
No problem.
That answers, people's questions about MDRT. So there's one question here about the medical lab program. When does it start and how much is it? I think that must have been someone who joined us a little bit later, but we can answer that here.
Excuse me. So those are good questions. We do 2 intakes every year. There's a beginning of May and middle of September start. And I don't know the exact number, but it's somewhere in the 3,500 range for tuition.
Perfect. Okay, thanks. And all of this information is listed on our website. It's vcc.ca. And you can go ahead and check that on our programs page. So everything is listed there. For rehab, I have not learned the medical terminology before. Where should I take this course? And is it possible to study it at VCC? How do I apply for that?
Hi, this is Carmen. And yes, for the medical terminology courses, there's a bunch of them online that you can sign up for. There is also VCC offers medical terminology here at the college. And the best thing to do is speak with advising as to which courses would be appropriate for admissions into the rehab assistant program. And there was just another question that I was typing an email to about the universities that accept our credits. And Thompson Rivers University in Kamloops, as well as Athabasca and the University of Calgary, all accept our program for 2 years, 2 years worth of university credits towards a degree. You'd have to complete your degree and then you apply to a master's program. So physiotherapists and occupational therapists are all master's programs in Canada. So you need to complete your degree, which our program can provide 2 years worth of that degree. And then you'd have to apply to the master's after that.
Perfect. Thank you so much for that answer. Okay, we have one, I think it looks like an advising question. I'm curious about how to do the upgrades to be sure I have the right requirements before I apply. I'm a mature student. It's been more than 5 years since I did biology and math, as well as the medical terminology course. How do we make sure we have all the requirements, and do they need to be completed before we apply, or can we get conditional acceptance?
Well, to answer that question, by the way, that's an excellent question. If you do require upgrading, I suggest that you book an appointment to speak to academic advising, and we're going to look at your documents. And if you need upgrading, then we'll connect you with the appropriate department. Upgrading at Vancouver Community College, you have 2 options. You can take it self-paced, and that is delivered by College Career Access, and in-class, which is under College Foundations. Just so you know, when you do upgrading at Vancouver Community College, we offer these courses into two parts, part 1 and part 2. So in other words, you need to complete those 2 parts to get to get a credit. Say for example, biology 12 part 1 and biology 12 part 2, and obviously that's biology 12 when you complete those courses. Upgrading at VCC is actually free, tuition fee free, but it's not really 100% free, just because you still need to pay some, additional fees, like obviously the admission fee. You still have to pay a student union and so on and so forth. But yes, it's free. There you go.
Perfect. Thank you so much, Dom. Okay, so the next question is, what's the waitlist for pharmacy tech?
Wayne, do you want me to answer that? Do you want to?
Go ahead, and I'll jump in if needed.
Sure. Here's the thing. As far as when you're applying to a program, just want to make sure, any program for that matter, I always recommend that you apply to the program and just submit all your requirements as later on. When you're applying to, say for example, pharmacy technician, you're actually applying to an actual intake. Now, here's the question. Does that mean I'm going to start on that intake? And the answer is no, because seat offering to any programs at VCC, except for dental hygiene, is first come, first qualified. So meaning you need to apply to the program and make sure that you have everything that we require before we offer you a seat. Now, just want to make sure that you guys understand that the acceptance letter, we usually send this out 2 or 3 months prior to the program starts. So, and the reason why we're giving you that, 2 or 3 months is because we want to make sure that you're ready financially. Like for example, if you want to apply for a student loan, you want to have that done just before you start, right? So there you go. So again, apply to the program. We're not going to stop you from applying. As a matter of fact, apply now, because if you apply today, we are waiving the admission fee, and that's going to be explained by Elizabeth later on. So again, apply to the program and submit your documents to ro@vcc.ca. And now, if you do have questions prior to applying, I always recommend that you speak to one of us. Again, 604-871-7000, press 2 to book the appointment, either by phone or by Zoom.
Perfect. Thank you so much, Dom. Okay, I do see a couple of questions being answered in the chat, so I'm going to move along. Does the MDRT program follow CSA group standards? Does the VCC's program only allow pursuit of this employment in BC, or is it Canada-wide?
Hi, Elizabeth. Thanks, Neil, for asking that question. So yes, the VCC MDRT program, the curriculum follows the CSA MDRT standards, and the VCC program is recognized as a training provider for MDRT in Canada. So when students take the VCC program, they're eligible to apply for employment in BC, all across BC and all across Canada. Our program is recognized all across Canada, from here, the island, all the way to the eastern provinces. Elizabeth, I have a few more questions that I jotted down. Should I wait, or should I just go for it?
All right, go for it.
Okay, thanks. So Neil, I hope that answered your question about the CSA. The answer is yes. Somebody asked a question about the May intake. There was a time where we thought we would run a May intake, but it's a little bit tight between the end of the winter intake and the beginning of the fall. So there will be no May 2021 intake at this time. Another student asked a question about the Duolingo assessment. So yes, we are accepting that for the VCC MDRT program, and the minimum score that we require is 105 for the Duolingo. You can get information either by sending us an email at health@vcc.ca, or you can check the VCC website in the Assessment Center webpage. And the deadline, somebody asked a question about the deadline for January. So there's, for the MDRT program, there is no deadline to apply. So when students apply, we put them on the wait list. When they finish all 4 admission requirements, then they will be offered a seat in an upcoming program. But students have to have finished all 4 admission requirements before they can get offered a seat. So there's space for January, there's space for next September, and I think that is it for MDRT. Yes.
Perfect.
Thank you.
Okay, we have a couple questions about advising and applying. So would you advise applying in person or by email? Right now it's happening online, but Dom, you can speak to that.
Yeah, right now, because of COVID, you cannot apply in person, but surely please apply online. When you apply online, it's very, very easy. You go to your program, your intended program, and then there's an option for you to apply online. When you click that link, it actually brings you to the BC Ed Planner, and that's where you're gonna see the intake that we're offering that particular year. So go ahead, pay $35 admission. But again, for today, until I believe October 16, you can waive the admission fee. So you're not going to be paying $35. So after you apply to the program, then all you have to do is submit your documents by email at ro@bcc.ca. Now, I saw a question about what if the program is already full? So what's going to happen to my application? Well, that's going to go and for the next intake. But just so you know, again, seat offering to the program is first come, first qualified. So bear that in mind. Okay. Thank you.
Thank you so much, Dom. Okay, so I'm going to get to the tuition prize and application fee waiver in just a moment. Let's see, what do we need to submit with our application? I think for that, it all depends on the program you are applying to. Again, go to vcc.ca, and we have all of our programs listed on our website, and each of them will have the requirements and all the things you need to support your application.
Well, I have, in addition, okay, so for those applying for the MDRT and you want to apply to MDRT, I suggest that you apply by email and then apply online through cstudies@bcc.ca. I want to make sure that you guys understand this. Program, there are 2 ways. When you apply to MDRT, we don't usually advise students applying to MDRT because this is a program that's offered by continuing studies. So in other words, you really have to connect with Rebecca, who's amazing, by the way. However, if you need to meet proof of English language proficiency, and that's the time that we advisors can help you with that. So for the nitty-gritty details of the MDRT, I always say, talk to Rebecca Bennett because she's the person that you really, really need to talk to. However, meeting the proof of English language proficiency for MDRT, you need to talk to us.
Perfect, thank you so much. Okay, I see that a question about the 50-hour for volunteer for Opta has been answered, so it's being suspended at the moment. And for MDRT, I took IELTS in 2018, Salban in 2019. Can they be credited?
Yes, so we accept the IELTS academic with an overall score of 6.5 and no band score less than 6. We do not accept the other assessment. I can't remember what I saw, but yes to the IELTS, no to the other one that was mentioned.
All right. Perfect.
Salban, I think, yeah.
Salban, no to the Salban. And IELTS has to be done within 2 years of applying to the MDRT program. So there's a 2-year expiry for our program.
For those asking the difference between IELTS and Salban, IELTS is, pretty much generic. It's a generic test. Salban is very, very specific for nursing professionals.
Thank you so much. This is great information. Okay, so we had such a great question and answer period. Thank you so much for your questions. We are just about to wrap up. So just a couple of things before we do that. These are a couple of services that are available to you as a student should you come here. We have things like scholarships and bursaries if you are in need of financial aid. We have Indigenous advisors for those who are from that community. And we also have sign language interpreters too for students with disabilities and so much more. We have free professional tutoring and counseling services. And of course, you heard from our advisor as well. So that's something for you to consider. Again, we talked about information sessions. We talked about meeting with an advisor. And if you are ready to apply, the link is right there below. And we talked a little bit about how to waive the application fee. So if you are a domestic student, we can waive the $35 application fee if you apply between today and Friday, October 16th. So that promotion goes on for a little while. And there's the promo code right there, info 1020, and the link to apply. And then lastly, our contest, of course. This is the exciting part. So there will be up to 3 winners who will be able to win $1,000 in tuition credit. There are a couple ways for you to do that. You can go to the link right there, vcc.ca/experience. And please use the code that's listed here, academia. You'll need that to enter. There is also a follow-up email that will be sent to you, and you can also apply that way as well. All right, I'm just going to check the chat box one moment before we sign off. For English assessment, applying to Pharm Tech, what are the alternatives? Okay, so perfect. Carmen responded.
Is that for pharmacy technician?
It is.
Okay, so for pharmacy technician, we're very, very specific. You have to do, if English is your first language, you have to do the reading and writing assessment specifically for pharmacy. Unfortunately, you cannot do that because of COVID. You have to take that in person. If English is your second language, you can definitely take IELTS or TOEFL. And again, the scores that you need to have is actually on the website, just so you know.
Perfect. Thanks so much, John.
I'll just jump in. I think we had, because of COVID, we had accepted IELTS in place of the ABE assessment.
Yeah. Okay. Yes.
And I looked yesterday. It looks like the assessment center is now available by appointment only for the math assessment to get into pharmacy. And keyboarding, I think they've made a provision to do an online version in conjunction with Selkirk. So as far as I know, there is a way to get the 3 assessments done. It may just take a little bit of organizing at this point.
That's correct, Wayne. Thank you.
Thank you. Okay, so for everyone who may have joined a little bit late or who need to pick up some more information, email addresses, there is a link to the PowerPoint presentation in the chat box. Feel free to follow that. Again, this is recorded, so we will send that to you once this session has ended. But other than that, I really hope if you do have further questions, please reach out to us, and we'll be happy to connect with you. Again, there is advising happening from now until 5 o'clock today. Please go to vcc.ca/experience and sign up for a session, and we'll be able to help you out. But we do have to wrap up. Thank you so much for your time, everyone. I hope you were able to gather all the information you needed, and we hope to see you very soon. All right, take care, everyone. Bye.
Bye.